Welcome to Primal Health. What is artificial intelligence? AI is the simulation of human intelligence by machine. It includes learning from experience, understanding language, reasoning, and self-correction. AI can be found in various applications, like virtual assistants, recommendation systems, self-driving cars, and more. It is categorized into two types: narrow AI, which is designed to perform specific tasks, and general AI capable of performing any intellectual task that a human can. Narrow AI excels at specific tasks, but can't operate beyond its programming. Examples include virtual assistants Siri and Alexa, recommendation systems Netflix and Amazon, image recognition software, and email spam filters. While artificial general intelligence strives to replicate human cognitive abilities across diverse tasks, allowing it to understand, learn, and adapt like humans. AI aims to enhance machine intelligence, empowering them to solve problems and make decisions effectively. The question is, will artificial intelligence replace me? Reflects a natural concern about the future. The short answer is no. AI technology won't be replacing healthcare workers anytime soon, but it's important to understand how it will impact healthcare jobs. Instead, it has the potential to enhance working conditions. The reality is that generative artificial intelligence in healthcare is about enhancing and supporting human capabilities rather than replacing them. By automating routine tasks, improving diagnostic accuracy, and allowing clinicians to focus more on patient care, AI has the potential to transform healthcare for the better. If you're a nurse, technician, therapist, or any other type of clinician, you will likely interact with this technology in the near future. Rather than taking your job, AI in healthcare is more likely to help you advance your career. Healthcare AI technology is designed to assist, rather than replace, humans. Artificial intelligence can streamline your job, making it faster and more efficient. For example, AI can help clinical teams write scripts, diagnose patients, and identify abnormalities in medical images. However, human oversight is still crucial to ensuring accuracy. Technology aids in task completion rather than eliminating the need for human involvement. Technology has supported basic healthcare functions for years. For instance, patients use the internet to research symptoms, while doctors employ robots in delicate surgeries. Telehealth technology enables chronic condition management from home, and some hospitals have used virtual nurse programs for over a decade. The term virtual nurse might seem intimidating, but it doesn't mean the end of human nurses. Due to a shortage of nurses, hospitals use virtual nurses to handle tasks that don't require physical presence, such as scheduling and remote monitoring. This support allows on-site nurses to spend more time with patients, enhancing their primary role. Generative AI and remote care technology can help manage workloads, reducing the need for overtime and improving work-life balance. This enables healthcare professionals to spend more time with their families and reduces job-related stress. Technology benefits patients by providing easy access to information and care, leading to higher satisfaction and engagement. Generative AI can expedite diagnoses, while nurses allow on-site staff to focus on direct patients' care, improving overall safety and outcomes. Happier, healthier patients also mean less time in the hospital, allowing healthcare workers to treat more patients or enjoy downtime. For AI in healthcare and virtual care to succeed, human involvement is essential. Healthcare employers need clinicians comfortable with technology to double-check AI-generated work and manage remote monitoring programs. While deep technical knowledge isn't necessary, understanding and using these tools effectively is crucial. Empathy and compassion remain irreplaceable in patient care. Healthcare facilities increasingly seek professionals with a positive attitude towards technology. Jobs requiring experience with remote monitoring and telehealth are becoming more common. Be sure to check out the links in the description below for some great products that have helped us on our journey to primal health. Embracing AI technology and gaining skills in quality assessment, leadership, and communication can open up new career opportunities. The real question is, how will my job evolve in the next 5 years, and how can I advance my career? Mastering AI in healthcare and related technologies can enhance your career rather than threaten it. To delve deeper into this issue, it's essential to understand the nuances of how AI is integrated into healthcare and why it serves as a complement to human expertise rather than a replacement. Generative AI's ability to analyze vast amounts of data quickly is one of its most significant advantages. This capability is particularly beneficial in fields such as radiology and pathology. AI algorithms can scan images for signs of diseases like cancer, providing a second pair of eyes and increasing diagnostic accuracy. However, these AI systems are not infallible and require validation by human experts. The clinician's role becomes even more critical in interpreting AI findings and making informed decisions based on a combination of AI input and clinical judgment. One of the pressing issues in healthcare is clinician burnout, often resulting from high workloads and administrative burdens. Generative assistant AI can alleviate some of this pressure by automating routine tasks such as scheduling, patient follow-ups, and data entry. For example, natural language processing, NLP, can transcribe and organize patient notes, freeing up time for clinicians to focus on patient care. This reduction in administrative tasks can lead to a better work-life balance, less stress, and ultimately a more effective healthcare workforce. AI in telehealth and remote monitoring has seen significant growth, especially during the COVID-19 pandemic. Artificial intelligence enhances telehealth by providing tools for remote patient monitoring. Wearable devices can collect data on vital signs, and AI algorithms can analyze this data to detect potential health issues early. This continuous monitor is beneficial for managing chronic conditions like diabetes, enabling timely interventions, and reducing the need for frequent in-person visits. Virtual nurses can assist in this process, providing guidance and support to patients and ensuring they follow their treatment plans effectively. While artificial intelligence can handle data and perform specific tasks with precision, it lacks the human touch that is crucial in patient care. Empathy, compassion, and the ability to understand and respond to a patient's emotional needs are irreplaceable human qualities. Healthcare professionals bring these qualities to their interactions with patients, building trust and providing reassurance. AI can facilitate these interactions by freeing up clinicians from routine tasks, allowing them to spend more time with their patients. As AI becomes more integrated into healthcare, the demand for professionals who are proficient in both clinical skills and technology will increase. Education and continuous professional development will be the ultimate keys. Healthcare workers should seek to understand the basics of AI and how it can be applied in their field. This doesn't mean becoming an expert in AI technology, but rather being knowledgeable enough to collaborate effectively with AI systems. Skills such as data literacy, technological proficiency, and the ability to interpret AI outputs will become increasingly valuable. Embracing innovative AI technology can lead to numerous career advancement opportunities. Roles such as clinical informaticists, AI trainers, and telehealth coordinators are emerging within the healthcare sector. These positions require a blend of clinical expertise and technological know-how. For instance, an AI trainer would work on ensuring that AI systems are trained on relevant and accurate data, while a telehealth coordinator might oversee the implementation and operation of telehealth services, ensuring they meet patient needs and comply with healthcare standards. The integration of AI in healthcare also brings ethical considerations that need to be addressed. Ensuring patient data privacy and security is paramount. AI systems must be transparent in their operations, and patients should be informed about how their data is used and the role of AI in their care. Building patient trust in AI technologies is crucial for their successful implementation. Healthcare professionals play a vital role in this, as they are the intermediaries between AI systems and patients. By explaining the benefits and limitations of AI, clinicians can help patients feel more comfortable and secure with these technologies. Achieving this transformation involves several key steps. It requires a proactive approach to embrace technology and integrating advanced tools and systems to enhance efficiency and improve patient outcomes. It is essential to engage in continuous learning and skill development to stay current with medical advancements and best practices. While technology and skills are crucial, maintaining the irreplaceable human touch in patient interactions is vital. By doing so, healthcare professionals can look forward to a more fulfilling and efficient career, ultimately leading to better patient outcomes and a more sustainable healthcare system. Thank you for watching, and we look forward to seeing you in the next video right here.